This is a colloquium that's being held in conjunction with the World Health Organization and the All-Ireland Institute of Hospice and Palliative Care to look at what was called the World Health Assembly resolution around palliative care as a life course approach and also in relation to public health. So what this particular event is about is bringing people together from across the world to look at that and to create a consensus which will then feed back into the formal response which will be given to the WHO next year. We have a series of sessions, and in each session there are speakers, international speakers, who are presenting papers looking at different aspects of the whole issue of palliative care as a public health approach. And at the end of that we then have questions which have been put together by an international panel of experts, and the members of the audience vote on those sessions, and then what we get is a summary report of what the general view is, and this will go to make a formal recommendation that will be submitted to the World Health Organization to be presented as part of the WHO resolution next April. And I think the very fact that we had the Minister for Health here yesterday, who clearly gave a very clear understanding of what palliative care is, means we've started to get, at a political level, our message understood.
An event like this is very important because it gives us an opportunity to learn from best practices from other parts of the world, helps us not to reinvent the wheel, but also helps us to think outside the box as we plan for the services that we deliver to our patients.
I think it's a fantastic gathering, and having people come together to share ideas is very, very important. Not only talking about models of care, but experiences with palliative care in chronic disease, which is one of the frontiers of adult palliative care. That's been very interesting for me as well.
Palliative care is a universal issue. Most people, it's the families who care for people who are at the end of life. And learning about how the role of families and carers is such an important part of palliative care, and seeing that valued has been very important for me.
This conference is really important for countries like my country, Colombia, because South American countries need to do many new things in palliative care for help the people who suffer terminal disease. Patients with no cancer disease like cardiovascular disease or neurological disease. This is a really important issue because this kind of patient is growing very fast, and the chronic disease is maybe in the next year the most important cause of death in our countries.
At a country level, we're seeing different models. Each country in its own context is moving forward to develop palliative care. We're all dealing with difficulties of how do we finance this, how do we develop workforce capacity, how do we create policies, so that it's a learning experience for everyone.
I'm working in a developed country in a very resource-rich setting. We got lots of developments in the last years, and so I could just sit back contently and just say that, we're doing this good. But if you look to other regions of the world like Africa, Latin America, then you realize that there are some models out there that might really be a good idea for your own setting as well. So for example, one thing I really enjoyed was the talk of Emmanuel Lyrica from the African Palliative Care Association. He talked about the models of palliative care that they have been implementing in different African countries. And there was such a wealth of information there and such a wealth of ideas that I thought this is really a wonderful example how much you can do even if you don't have the best of resources available.
Hearing from the Kerala model from India helps one to think about which approaches to use to engage the community and ensure that the community owns the palliative care programs that are going on within the context of that community.
Yesterday I chaired a session where we heard about, in Romania, a national champion leading an effort that was focused on cancer patients who now have expanded to involve all patients with non-communicable diseases. So different models, different people, all of which demonstrate that if you have great national champions and a will to move this forward, that leadership can make a difference.